Hey guys, it's Patrice Adeline from BeautyTimeRN.com. I'm a registered nurse and I specialize in plastic surgery and aesthetics. In today's video, I'm going to be sharing with you guys everything you need to know about lip augmentation with lip fillers. So people get lip fillers for a lot of different reasons. Three of the main reasons are lip volume, lip structure, or lip asymmetry. So a lot of people come in, especially if they're younger, and they've been seeing that a lot of their favorite celebrities have fuller lips like Kylie Jenner or whoever. And even though they may not want Kylie Jenner lips, they're kind of starting to notice their own lips more, and they're thinking that if they have fuller lips, it may be a little more attractive. So they're coming in because they want a little bit of volume. Other people are coming in maybe because they have lip asymmetry, which is when one side of the lip is smaller or bigger than the other side of the lip. And then other people are coming in because the structure of their lip has kind of gone away over time. So as we age, our lip gets thinner. We may start to lose our Cupid's bow, which is here, or our columns, which are up here. And people may start to get the bleeding lipstick lines, which is when you put on the lipstick and they kind of start to bleed into the little lines around the mouth. So those are three different reasons why people will come in and ask for lip fillers. There are different ways to augment the lips. So there are lip fillers, which is usually hyaluronic acid that we put in. There's also semi-permanent or permanent fillers, and then there's fat injection into the lips. Now, my preferred method is hyaluronic acid lip injections versus the permanent fillers, which I think have gone away over time. Thank God, because they have just created a lot of problems for people, and I do not recommend permanent lip fillers. Fat injection to the lips, I think it's really important. If you do it, you see a really experienced plastic surgeon, because you do not want to end up with lumpy or uneven lips for fat injections. But with hyaluronic acid, it's a much more controlled procedure, and people are much more likely to really like their results. So the number one concern people have when coming in to get lip fillers is they don't want unwanted results, unnatural results. They don't want to come in and look like a monkey or a duck afterwards, or whatever kind of animal they can think of. They want to walk out and look natural. They just want an enhancement. Now, some people do want a more exaggerated difference, but most people, especially where I live in New England, they want a very subtle change. And the way you're going to get that is by going to see an experienced injector that, first of all, is going to take your race and your anatomy into consideration. And second of all, they're going to talk to you about your goals. Now, like I said, some people want a lot of volume, some people may be nervous and they just want a slight enhancement, and that's totally okay. Now, the way we do it in our practice is we'll talk to the patients, kind of see what their end results are, and if they're really nervous, I'll start with maybe just using half of the syringe, or I'll just kind of feel it out and decide based on their anatomy. But I'll save the rest of the syringe because you are purchasing the whole syringe, so I'll save the rest of it and have them come back in 2 weeks and go from there, rather than putting too much in and giving them an unwanted result. Now, also the way the injector injects is gonna prevent the patient from looking unnatural in the end. It's not about just how much volume they're putting in, but it's also their style of injection as well. So if you do happen to have unwanted results, or lip fillers aren't exactly what you thought they were going to be, the nice thing about getting injected with a hyaluronic acid is that it has an antidote, which means it has something that the injector can inject into your lips and make that filler go away. It's called hyaluronidase or Hylenex, and the injector can inject that into your lips, and like I said, it will make that filler go away and you will return back to what your lips used to look like. It is still really important to see an experienced injector, even though you can reverse this filler. But the nice thing about it is if you are worried about looking unnatural, you can always reverse it. Other questions that people will have when they come in to get lip filler is how long before I see results and how long will my results last. So the results are pretty immediate. I mean, you do have some swelling, some possible bruising. The swelling for about 24 to 48 hours. The bruising can depend. It usually does go away by a week, sometimes in a little as a couple of days if you do get any of those, but it does go away. So after the bruising and the swelling goes away, the results are immediate. You can see what you have. And it does last, it's FDA approved for a year. I think it kind of depends more on the person's metabolism, since it is something that gets metabolized out of your body. So if you have a really high metabolism, you're a runner, it may not last as long as somebody else's. Now, in my own lips, I think that I've seen it last probably about 10 months or so. Probably not a full year. I mean, it does last till a year, but since it does get smaller as time goes by, like it doesn't last a year and then it goes away at the 1 year mark. It gets smaller and smaller, you know, over time. So just by maintaining it, I think I would go back and get mine done every 10 months. And another way that I've noticed in my practice to help people last the lip filler a little longer is just by putting a couple of units of Botox around the perioral area. And what you're doing is you're kind of relaxing that area a tiny bit, and therefore the product won't shear as much when you're talking or things like that, and it will last a little bit longer. In terms of bruising and swelling, there are a couple of things you can do to prevent or make them go away faster. Some of the things you can do is you can beforehand avoid to take any blood thinners, such aspirin, ibuprofen, Aleve, Motrin, fish oil. All of those and some others can all contribute to thinning your blood, which will increase your chance of bruising. Now, if you do get bruising, another thing you can do is take some arnica, which is a natural herbal medication that can help with bruising. And you can also try fresh pineapple if you like pineapple. It has to be fresh though, it can't be canned, it can't be pineapple juice. So those are the couple of different things that you can do to both prevent and speed up your healing. People also wonder how painful are the lip fillers going to be. There is a needle going to your lip, so there is going to be a little bit of a pinching sensation. Everyone's pain threshold is a little bit different. So I mean, I've had people that don't react at all, and I've had people that find it really painful. I know I'm a big baby, so when I get my lips done, I'm practically jumping off the chair. But like I said, some people are very comfortable during it. We do try to help by putting on a topical numbing agent. So it's just a cream we put on. We have the patient sit in it for about 15 minutes. And we will also do ice as well. And the actual syringe of hyaluronic acid also has lidocaine in it. So as I'm injecting, the patient gets more and more comfortable because the lidocaine in the syringe is further increasing their comfort. Unfortunately, just like with anything, there are possible complications with lip fillers. Like I mentioned before, bruising, swelling, and possible vascular occlusion. What is vascular occlusion? It's basically if the lip filler gets put into an artery, it blocks the artery and the blood supply won't be able to go through. Now, this is very rare, and most offices, most reputable places will have a protocol in place if something like this was to happen. And I think by searching for a reputable provider that knows what they're doing, knows the anatomy, knows how to prevent this complication, and also has a protocol in place for this complication, you're gonna feel much more safe and you're not gonna face this unwanted complication. Now, if you're looking for a cheap place to go to, you found a coupon, you're out of the country, this is not one of those procedures I would suggest doing at a place that offers a coupon, or you found out about them in another country. I just would not do that because, like I said, the complication is something that is serious and a reputable place will be able to handle that correctly. But before that scares you away, I just want to say it's extremely rare. I've never seen it happen, and I just wanted to mention it because this is something that I would not want to see somebody price shop around for. A big determining factor when people are considering lip fillers is obviously cost. Cost can vary greatly based on your geographical location or the person injecting and their experience, but it usually varies, I want to say, between $400 and $700, and that's per syringe. So when you're thinking about it, the best thing to do is go for a consultation and see what they would recommend for you and have them give you a price. For me, I get less than one syringe put in my lips, but I would have to buy the whole syringe even though I'm getting less than a syringe, because practices can't share syringes between people, obviously. So a lot of celebrities probably may get more than one syringe or two syringes. So if you want really, really full lips, you're probably looking at getting around 2 syringes in your lips. And so then you're purchasing 2 syringes. It's not just one flat price for a lip filler augmentation. You're purchasing it by syringe. There are no additional costs when purchasing the syringe. There is a consult fee that we charge in our practice, but then we apply it to the cost of the syringe. We don't charge any additional costs on top of that, like for follow-ups or for the time that you're there. It's just, you're just paying for the product, and everything else is included in that. I'm not sure if other places do it differently, but that may be something you want to ask. However, in our practice, we just charge you for the syringe and everything else is kind of included in that. The only other time you might acquire a cost is, let's say you go to one place, you hated it, and now you want it taken out, like I mentioned before, with the Hylenex or the hyaluronidase, depending on how you want to call it. Then if you go to a different place, they might charge you for the hyaluronidase. So that is the only other time you're going to acquire an additional cost. Thank you so much for watching. If you liked my video, please give it a thumbs up. Please subscribe so you don't miss any future videos. Please comment below if you have any additional questions about this topic. I'm also going to link my website, beautytimern.com, for more information where you can find my article on this topic. And also I will link my social medias below. See you next time.